Hey, what's up everybody, and welcome back to The Sanctuary. I'm your host, Professor C, and we're going to be doing some more A&P today. Specifically, we're going to check out the abdominal muscles, or colloquially known as the abs, dude. So let's check them out. The abdominal muscles form the lateral, that is the outside portion, and the anterior, that is the front portion of the torso, or the abdominal wall. They have structures anatomically called fascicles, and those fascicles will run in directions like this. We'll have fascicles running this way. We'll have it layered with another set that runs that way, and then we'll have another set over here running this way and another set running this way. And if you start to arrange these fascicles at angles to one another, you can add flexibility and strength to the actions of those muscles. Now, all of them are going to be innervated by rami, or branches of the spinal nerves, and I'm not going to be too specific because we haven't gotten into that yet, but I will list them out for you here. Combined actions is flexion and rotation of the torso or the trunk. It also helps you do things like vomit, cough, scream, birth a baby, urinate, and defecate. The way to remember the abdominal muscles is what I call the TIRE method. And notice how I've spelled it here. I've put a big T first, and then I've put a little I and R together in the middle, and I've put an E, a big one, here at the end. And so what that's supposed to represent is the deepest layer starts with a T, the most superficial layer will start with an E, and then in the middle there will be a single layer, but there will be two different muscles represented there, an I and an R. So these are the four abdominal muscles, and we're going to use the TIRE method to learn these. T is transversus abdominis, and we just said it's the deepest one. Right here on the image, I'm marking in red where you would find it. Now the white stuff is aponeurotic tissue, tissues of an aponeurosis, connective tissue that are holding together the sheets of muscle. So the actual muscle is the brown stuff, but we usually draw it like that to show you where it is. Now it's all throughout underneath there, but they've cut away a portion of the image there so you can see just a part of it. Here are the details of it if you would like to see those, and there are the specific spinal nerves that innervate it. Now when we get to the second level, the middle level, we're going to see two of them, an I and an R. The I is for the internal obliques, and I'm going to change my color so you can see it a little bit better, but right here where I'm drawing, those are the internal obliques. I've included a little bit of that aponeurosis, but that's okay. Now you can't see them on the other side, nor can you see the transversus because they're covered up by the other layers. So here's the details. Linea alba refers to, well, it literally translates to a white alba line, linea, white line. And it's this structure right here that runs right down the middle of the body and holds all those musculatures together. So again, these are going to have similar actions to compress, rotate the abdomen, and they will all be innervated by a variety of spinal nerves. R, remember the TIRE method, I and R share the same layer. R is for rectus abdominis. Remember the word rect we've seen before refers to right, like a rectangle running at a right angle. Rectus abdominis go like this, and this is what you would call your 6-pack or your 8-pack or whatever you prefer to call that. Here are the details of it. Again, similar actions, similar innervations. Now E is for the last set, and I'm going to highlight it here before I show you. We should see E is the most superficial layer, and it's going to run all the way up here on this person, really nicely defined external obliques. External obliques. Can't really see the way the fascicles are running, of course, because there's skin in the way. And then here, of course, is really nicely defined rectus abdominis. So here are the details for the external obliques. Notice lots and lots of insertions, more than I've listed here, and the actions and innervations are similar to the other abdominal muscles. So keep in mind the TIRE method. Transversus is the deepest. I and R share the middle layer, that would be the internal obliques and rectus abdominis. And then E, the most superficial layer are the external obliques. All of these are involved in flexion and rotation of the torso. Hope you enjoyed that little talk on the abdominal muscles. Thanks for watching it. Check out some more videos if you want to learn more about A and P. See you for the next one. Bye-bye.